Hi, I'm Evan Merida. I'm a counselor trained in pain reprocessing therapy, and I love working with clients who have long histories of pain like back pain, knee pain, foot pain, wrist pain, headaches, irritable bowel syndrome, and so forth. I'm here to share a very exciting study that was recently published on the effects of pain reprocessing therapy on back pain. I'll summarize some of the major points for you now. Did you know that approximately 85% of cases of back pain seem to be best explained by central nervous system processes? Even if you have old injuries or things like bulging or slip discs, scoliosis, spinal stenosis, spondylolisthesis, and so forth, there's a very good chance that your pain is coming not from those things, but rather central nervous system processes. And that is great news. By central nervous system processes, I mean your brain and the neural network that connects your brain to your body to monitor your well being, to keep you safe from harm, which is where we get reactions of fight, flight, freeze, and appease. One funny thing about the central nervous system is that it is notorious for overreacting. Many of us are wired like car alarms that go off when a leaf drops on the hood of the car, perceiving danger where there is none. And the brain is a prediction machine, constantly predicting what might cause or be causing us bodily harm, usually erring on the side of being better safe than sorry, and therefore making a lot of mistakes. The brain has the amazing power of amplifying signals like a hearing aid. In most cases of chronic pain, the brain seems to be taking ordinary, harmless body sensations and amplifying those sensations to the point that they become very real pain. Note that I didn't say that the brain imagines pain. I said that the brain amplifies ordinary, harmless sensations so they become real pain. Even though it's a false alarm, it really hurts. What fuels the pain to stick around so many months, years, or even decades? One, fear of the pain. Two, avoidance of the pain. Three, incorrect beliefs that pain equals injury. It's estimated that up to 20% of the people living in the United States have central nervous systems that amplify ordinary harmless sensations into very real pain, which is why this study is so important. I bet everyone watching this video knows at least one person who has some form of chronic pain like back pain, migraines, knee pain, foot pain, abdominal pain, etc. Pain reprocessing therapy, abbreviated as PRT, was created to help the very large population of people whose brains cause chronic pain. By the way, as you may have guessed, I am one of those people. In my lifetime, I have experienced back pain, hip pain, foot pain, wrist pain, knee pain, abdominal pain, each of which lasted for years. I spent tens of thousands of dollars on medical bills, countless hours in doctor's appointments, chiropractic, acupuncture sessions, alternative, naturopathic, functional medicine consultations, and supplements. And the only things that really helped me were one, pain reprocessing therapy, and two, using more muscles in my body with the help of postural therapy. I'll put a link in the description for a clinic that I highly recommend for postural therapy, but the rest of this video is just about pain reprocessing therapy. The PRT study recruited participants from Boulder, Colorado, aged 21 to 70 years old, who had back pain for at least half of the days of the last 6 months. These folks rated the intensity of their pain as, on average, at least a 4 out of a 10. They had, on average, a pain history of 10 years, be it back pain or pain elsewhere in their bodies, like head, hip, foot, knee, wrist, abdomen, some combination. Participants were randomly split into 3 groups, with about 40 people in each group. The first group was given the control group assignment, which means they were given no additional treatment beyond what they were already doing before the study. And after the study, that's when their pain levels were compared to the other 2 groups in the study. The second group was what's called an open label placebo group. These folks watched videos about how placebos can trigger the body's natural healing response, and they were given saline injections, salt water under their skin, and they knew it was just a placebo. The third and final group was the pain reprocessing therapy, or PRT group. These folks got a full course of PRT in which a therapist helps with the following. 1. Learning about how the brain can mistake harmless sensations for dangerous ones and create pain where there should be no pain. 2. learning how their own pain is caused by not the body, but by the brain. 3. Doing exercises that retrain the brain to stop misinterpreting danger or harm where there is no danger or harm. 4. Exploring ways in which emotions, relationships with other people, and the world around us impact pain levels and what to do about that. And 5. Establishing habits that increase positive emotions and self-compassion, both of which reduce and interrupt pain in the future. So what happened in the study? I'll walk you through 2 charts that show results. First, let's look at pain intensity. The researchers asked participants to rate their pain on a scale of 0 to 10, where 0 means no pain, 10 means the most intense, unbearable pain imaginable. The mean or average pain intensity scores for the usual care and placebo groups only dropped from around a 4 to around a 3 and stayed around a 3 at each check-in, 1, 2, 3, 6, and 12 months after treatment. Reduction from a 4 to a 3 is a pretty meaningless change for most folks, unfortunately. But check out the PRT group. These folks, on average, started at a mean pain intensity score of 4 and finished treatment just above a 1 and stayed there through the 12 months of check-ins. Some of these folks were entirely pain-free. We can only assume that most of these folks are still experiencing much less pain than they did before pain reprocessing therapy. A reduction from around a 4 to around a 1 is a significant reduction, one that makes a huge difference for people with chronic pain, allowing them to lead very fulfilling lives, nearly pain-free or completely pain-free. Next, let's look at percent change in pain intensity from before treatment to post-treatment. In the placebo and usual care groups, a few people said their pain intensity ended up about 45% worse at the end of the study, and many folks reported 0 reduction in their pain intensity. The PRT group didn't even have one person who said their pain worsened, and look at how many people found 100% relief from their pain. 73% of those in the PRT group reported that they became pain-free or nearly pain-free. And a good number of these folks had significant spinal abnormalities that they had for a long time been wrongly assuming were causing their pain. The PRT group also had significant reductions in anger and disability, so PRT could help a lot of folks reduce their anger and disability, letting them enjoy life more, improving their relationships with others, and helping them participate more in activities that they used to enjoy before the pain started. And 85% of the PRT group became free of panic symptoms. I've seen a lot of folks develop panic disorders during the pandemic, not because they had COVID-19 infections, but because of the fear and stress that they experienced in response to all of the changes and worries about the pandemic. And clearly, there is hope with PRT. If you're still watching this video, you might be someone who could overcome chronic pain with PRT. PRT has made such an impact on my life personally that I am so excited to be sharing this therapy with my clients at Sun and Shade Counseling. If you are interested in having a conversation about PRT and whether the therapy might help you, please contact me for a free phone consultation.